All right.
Okay, so let me get started because I have an introduction to do. So hi everyone. My name is Jane Burke Miller and I'm a Senior Mental Health Training and Implementation Associate at the Center for Psychiatric Rehabilitation at Boston University. And I'll be the moderator for today's Making Sense of Employment Research webinar. My colleague Amanda Lowe is here as well, providing technical support. The webinar is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. The webinar content does not represent the views or policies of the funding agency, and you should not assume endorsement by the federal government. The territory on which Boston University stands is that of the Wampanoag and Massachusetts people, and we honor and respect the history and current efforts of Native Indigenous communities. This webinar is being recorded so that you can access it later. Also, closed captioning has been turned on, and you can access this by clicking the button at the bottom of your screen. In case this is your first webinar with us, I'm going to introduce our speakers. They will share their research with you, and then we'll have a question and answer session at the end. If you have a question during the presentation, please post your questions in the Q&A box or in the chat, and I will pose them in order we received at the end. If you have a technical question, please send a chat to me directly. Also, we would really appreciate your feedback about this webinar, so we'll be posting a survey of your opinions at the end of the session. Please also feel free to introduce yourself, where you are and what you do in the chat so everyone can see who is here for our discussion. Now I'd like to welcome our speakers for today, Haley Payne and Dr. Elizabeth Thomas, who will be presenting their research paper, Supporting the Young Adult Peer Support Workforce, Insights from a Survey Study. Young Adult Peer Support Workers, or YPSWs, are trained professionals, typically 18 to 30, with lived experience of behavioral health conditions, and they are an essential part of the they are essential and growing part of the behavioral health workforce. However, research on their workplace experiences remains limited, with existing studies largely relying on qualitative methods and small samples. This webinar will present findings from a survey study examining the workplace experience of YPSWs across the United States. These findings explore key domains including job satisfaction, supervision, intergenerational workplace climate, and experiences of stigma, and differences in these domains associated with certification status, including disparities in perceived opportunities, rewards, and supervision. So today, Haley Payne is a graduate student in the Clinical Psychology Department at the School of Applied and Professional Psychology at Philadelphia College of Osteopathic Medicine. Currently, she serves as a practicum student at Brookline Behavioral Hospital, servicing individuals with serious mental health conditions. Her research focuses on stigma and lived experiences of individuals who have personality disorders and other serious mental health conditions. Dr. Elizabeth Thomas is an assistant professor in the Department of Social and Behavioral Sciences at Temple University's Barnett College of Public Health. She serves as co-director of the UMass Chan Temple Community Inclusion and Reflective Collaboration Center and an investigator within the Temple University Collaborative on Community Inclusion. Her research focuses on promoting mental health and community participation among young adults with serious mental health conditions, with an emphasis on peer support and self-determination. Welcome to you both. We are excited to hear from you.
Thank you so much, Jane, for that nice introduction. And thank you for the opportunity to be here. It's certainly a pleasure. As Jane said, my name is Liz Thomas, and I'm a faculty member at Temple University. My research has for a long time now focused on peer support and the important role that peers can play in promoting recovery and community participation. And I'm also a mental health services researcher focused primarily on services for young adults. So the project that Haley and I are going to be telling you about today really relates to both of those areas of my work. So Haley and I worked on this project together. I'll give Haley a second to introduce herself, and then we'll launch into the presentation.
Hi everyone. My name's Haley, like Liz said. It's great to be here today. My role is kind of being a student right now, but I hope to work with people who have lived experiences of mental health conditions, particularly serious mental health conditions.
Great. So Haley's going to talk a little bit about this paper that we published together, and we'll go through the different pieces. So Haley, do you want to take it away?
Sure. So our study focused on a survey. The whole title is a survey study of workplace experiences of young adult peer support workers in the United States. We have an agenda, so we're going to go through the background, the methods, results, and recommendations. I do want to just kind of give a shout out to the work that we did with other members who are not here today, but they really played a huge part in our success of this study. So like I said, 2 out of 5 of us are here. Myself and Dr. Elizabeth Thomas. Alongside this work was Dion Regis, Maggie Smith, Roshni Stanford, and Brandon Bond. And like I said, this would not be possible without all of us. So just going through the background. Um, yeah, thank you. So, kind of a definition. So, young adult peer support workers are people with trained mental health, trained mental health workers, typically aged 18 to 30, with lived experiences of a behavioral mental health condition. Young adult peer support workers, or YPSWs, are near a youth age and have personal experiences of conditions themselves. They use experience, strength, and hope to inspire and help others in their recovery journey. So, what Liz is going to help us answer today is why are YPSWs such an integral segment of the mental health workforce?
Yeah, thanks, Haley. So I think Haley's asked an important question here. Why are young adult peer support workers, we'll refer to them as YPSWs for the remainder of the presentation, why are they so important to the mental health workforce, especially the workforce that serves young adults? We're going to answer this question from a few different vantage points here. One is that we believe YPSWs can bring their unique skills and expertise to supporting fellow young adults. And we know from the general peer support literature that peers work in a variety of different roles, conduct a number of different activities, but they generally report doing the following things: sharing their own lived experience to benefit others, serving as role models and exemplars of recovery in action, promoting hope, promoting healthy behaviors and self-care and wellness. They can connect individuals to community-based resources, many of which peers may have used themselves and have personally vetted. They can encourage self-determination and personal responsibility, self-advocacy with mental health providers. They can provide education about illness or wellness management, again, coming from their own personal experience and what's worked well for them. And finally, they can combat stigma, again, by serving as examples of recovery in action. They can sometimes break down stereotypes about people with mental health challenges, and by doing so, combat stigma. So all of these different activities are ways that peers can positively benefit fellow young adults. Second, a meta-analysis of recovery-oriented interventions for people with serious mental health conditions that I conducted in collaboration with some colleagues from the University of Maryland found that when interventions were delivered by both clinicians and peers, they demonstrated the greatest differences in outcomes like recovery, hope, and empowerment between treatment and control groups. And this might be because clinicians and peers can provide complementary but distinct supports in order to facilitate recovery. So based on these findings, we can extrapolate that YPSWs are integral because this collaborative delivery of services between clinicians and peers could lead to the greatest recovery outcomes among young adults. YPSWs may also be able to facilitate service or treatment engagement, and there is some emerging literature to suggest that this is the case. There's one study that was conducted by Ojeda and colleagues that showed that the availability of peer support within mental health service settings was associated with an increase in treatment engagement among young adults aged 16 to 24 years. And interestingly, it also found that there were reduced disparities in service use among Black and Latinx young adults, especially when there was a peer that matched their racial and ethnic background. And there are many ways that peers might be able to facilitate treatment or service engagement. We really need to look into this further, but it's plausible that they may be able to do this due to some of the things we've mentioned already, this positive impact on hope and empowerment, reduction in stigma, helping peers set and move towards personally meaningful goals and helping increase their motivation and activation to do so. And again, helping peers access self-advocacy skills that they may need in working with mental health treatment teams. A final reason why we believe YPSWs are critical is that the benefits of young adult peer support also extend to those in YPSW roles themselves. For young adults with mental health conditions, employment in general is associated with things like enhanced self-esteem and increased capacity to manage mental health challenges. And for those serving in YPSW roles more specifically, it can help increase things like self-acceptance, especially as peers are coming to terms with things that have happened to them and sharing their lived experience in a way that benefits other people. It also can help improve social and professional skills. Oftentimes, these are the first employment experience that YPSWs may have. So it's an important opportunity to learn these professional skills that they may need. And then, of course, it also can open the door for career opportunities as well. But despite all of these different benefits, we know that there are challenges. Young adult peer support is an emerging field with challenges that are similar to challenges experienced in peer support roles more broadly. Some of the challenges that we know of are things like lack of clear role definitions, wherein peers might have been trained to do one thing, but the realities of their jobs don't exactly match their training. Some also report poor supervision experiences or not really feeling like supervisors understand the unique needs of young people serving in these roles. Low pay is a commonly reported challenge, not only among YPSWs, but peer support workers more broadly. And some also report experiencing stigma related to their mental health from coworkers or supervisors as well. Again, a lot of these challenges are not specific to YPSWs, but for YPSWs, they may reflect intersecting biases related to both mental health status and age. So there could be multiple kind of sources of disadvantage for young people in these roles. So to support the creation of more supportive workplaces for YPSWs, Haley and I and our colleagues conducted this survey study to gain a deeper insight into the experiences of YPSWs on the job. We wanted to learn from them directly, and we were interested in sources of satisfaction and dissatisfaction, as well as what they perceived as common barriers and possible solutions to those barriers or recommendations that they may have. While there has been some research to date on this topic, much of the research has been qualitative in nature and was limited to smaller sample sizes within specific workplace settings. So we really wanted to implement a primarily quantitative survey to a larger number of YPSWs working throughout the United States to better understand the extent to which they were satisfied with various aspects of the workplace and to produce knowledge that could hopefully be generalizable across contexts. And a particularly novel aspect of our study was that we examined whether workplace differences or workplace experiences differed according to YPSW characteristics. In this case, we were really interested in certification status. Because some YPSWs have received general certification in peer support, others complete a more youth-specific certification, and some don't receive certification at all, we wanted to better understand whether these differences in training and preparation could shape workplace experiences. And we thought that it could be possible that being certified could influence things like a worker's expectations for the job, certainly their preparation, perhaps their credibility or access to resources. And all of these things could potentially shape their experiences in the workplace in ways that were different from non-certified peers. So I'll turn it over to Haley and she'll walk you through our research questions and some of our methods.
So, some of the research questions, we had three of them. What are the workplace experiences of YPSWs? How do workplace experiences differ based on certification status, so certified versus non-certified? And what do YSPWs perceive as barriers to their success in the workplace? And what are some of the recommendations for workplace improvement? So, sorry, I was just going to say now we're going to go to the next slide. So, I will talk about kind of how we did the overall conduction of the survey. So, we recruited YPSWs online nationally. We recruited from different organizations, so things like different peer certified specialist sites. So things like youth in general. So Youth Move, Mental Health America, the Copeland Center, kind of those places to kind of look for participants. Inclusion criteria was you must have been 18 to 30 years old and in a peer role that was either part-time or full-time. And it also had to be a paid position. You must be fluent. You must have also been able to be fluent in English and be able to provide informed consent. Um, as well as that, it was open to, like I said before, people that had certification or did not have certification. And there's peer support workers, and then the survey was conducted March 2023 to April 2024. And so the measures. So looking at the different measures, we took from the job training and job sort of satisfaction survey to look at benefits, training, pay, things like that. Satisfaction within the supervision scale. So just looking at general supervision experiences. The workplace intergenerational climate scale to look at, in a climate between different ages, workplace experiences, things like that. The stigma scale to look at perceived mental health stigma from colleagues. And qualitative and quantitative analyses were demonstrated and developed based on working with a group of YPSWs and experts in the mental health field. And then along with that, kind of all of these different things I just named were kind of taken from different things. So different scales were taken to look at different orientations of different items we were looking at.
Okay, thanks, Haley. So a little bit about our data analysis process. For research question one about YPSW's workplace experiences, we conducted descriptive statistics at the item level, so things like counts and frequencies. To address the second research question, exploring differences in workplace experiences by certification status, we conducted a series of one-way ANOVA tests, and the relevant subscale or total scores from each of the measures served as the dependent variables in these ANOVA analyses. Certification status was the independent variable, and we categorized certification status according to general peer specialist only, youth certified peer specialists that included those who had youth certification only or said they were also general certified. And then the third category was non-certified peer support workers. For research question 3 about workplace barriers and potential solutions or recommendations, we primarily analyzed open-ended items from the survey qualitatively. There were 2 independent coders, with Haley being one of those, and we conducted an integrated thematic analysis. So we'll go through our results. So the final sample was comprised of 49 YPSWs. And as you can see from the graphic, most of the respondents were white and female, with a smaller proportion identifying as male, or as members of racial, ethnic, and gender minoritized groups. Most reported having psychiatric diagnoses of anxiety or mood disorders. Other diagnoses included schizophrenia or schizoaffective disorder, personality disorder, or other. The majority reported an annual salary range between $20,000 to $49,000. The most frequently reported work settings were outpatient and telemental health that included video conferencing, telephone. Some also reported working in other settings like schools, crisis centers, and nonprofit organizations. 17 were general peer specialists only. 4 were certified youth peer specialists only. 13 indicated dual certification, general and youth, and 15 were non-certified. Most had been in their positions for between 1 to 3 years, so relatively short amount of time. And on average, respondents were about 26 years of age. So related to research question 1 about workplace experiences, most respondents reported relatively low satisfaction related to pay. So only about 43% felt that they were paid fairly, and 57% reported feeling underappreciated based on pay. But at the same time, perhaps more optimistically, respondents reported relatively high satisfaction with things like fringe benefits, organizational support for training, and training experiences. And most respondents perceived a positive intergenerational climate. So, for example, 78% felt that people of all ages were respected in their workplace. But notably, fewer people agreed that being younger was viewed as a strength in their workplace. Continuing on average, respondents reported high satisfaction with supervision, with at least 60% reporting that supervisors demonstrated positive supportive behaviors like active listening, recognition of their contributions, constructive feedback, and demonstrating respect. Responses were more mixed on items like supervisor availability, fairness and delegation, and conflict resolution, and effectiveness in addressing underperformance. And then finally, many respondents didn't overly endorse experiencing stigma from coworkers. About 55% disagreed that they'd been discriminated against due to their mental health. 45% felt comfortable with coworkers knowing about their mental health history. In relation to research question 2 about differences by certification status, there were indeed several important differences based on certification. So youth certified peer specialists reported lower satisfaction with pay and fringe benefits in relation to their non-certified peers. And they also reported lower satisfaction with supervision versus those who had received general certification. There weren't any differences across groups in terms of organizational support for training, perceived intergenerational climate, and stigma. Haley's going to tell us a bit about the qualitative findings now.
So research question 3 focused on barriers and recommendations. So this was mainly the qualitative analyses. Um, there are different key themes, but in general, we had 9 respondents for barriers reporting no workplace barriers, 18 reporting barriers in different key themes, so workload, policy, and individual. With limited time is kind of went hand in hand with caseload. So a lot of individuals wrote that because of their large caseloads, they were less likely to spend time with their peers and meeting other demands of the job. With caseload, a lot of people presented with having too high caseloads. There was an individual who reported a lower caseload, but that meant that they really had nothing to do at their job with all this free time, which I thought was very interesting to me. So policy demonstrated that like things like social media or in general, just being one example, that there wasn't a lot of flexibility in the way that people met with their peers and kind of supported their peers in the way that they felt was comfortable. So um, that is just one example. With individual, there were also personal barriers like financial and mental health. And with that, there was difficulty getting certified. And that was dependent on a number of factors. A lot of people said that their organizations had difficulty just not only understanding what peers did, but kind of why it is important to have that certification status. And then these are just some quotes that we found. So I'll pause for a little bit just so people can kind of read these over. Okay, and let's jump into the next slide, please. Okay, so key recommendations and themes. So this kind of on the flip side of barriers are kind of the recommendations that people had going off of some of the barriers. So with that, there was leadership. So they said that a lot of peers said that to address the age-related dynamics, people must be open to feedback, especially supervisors. And also leadership listening to the suggestions and not being dismissive due to age or certification status or non-certification status and things like that. With policies, enhancing structure of work environment through policy. So a lot of people responded that there was not a lot of clear guided or a lot of clear expectations in their role. And like as a result, they kind of felt not guided or not able to effectively do their job. So having policy improvements related to that and kind of the daily job duties of what they want to do and what they're required to do and what a peer actually does. So Liz had mentioned earlier that a lot of people might have that lack of role clarity because a lot of people in higher supervision statuses may not know what a peer is or the main role or responsibility. So having that policy to ensure they're actually doing what they need to be doing. And then job incentives. So increasing pay, improved benefits, expanding opportunities for advancements and growth. Um, Another common something was enforcing workforce capacity and support. Another thing is things like ongoing training, additional resources, and hiring more staff. And so with another oh, I'm sorry, I jumped too fast. But with that, I'll go the next one. Yes, 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 I could. Sorry. So yeah, so another part of that is like I said, ongoing training, providing resources. So a lot of people said that like barriers to getting to their peers was like things like not having transportation, not having a way to connect with their peer through like the time that they weren't meeting physically. Another thing was related to more staff and adjusting the workload, like I said. So people weren't either um, like overworked or underworked. And then another thing was the peer integration. So due to the lived experiences, this kind of has the opportunity for YPSWs to create more opportunities for their teams. And as a result, you can really enhance the collaboration and inclusion that individuals with this certification or peer role can have. So as a result, you can have more promotion, diversity, team-based communication, and engagement through fostering connections with other things like other programs or other support systems, or even kind of crossover for the different types of roles you can play. Yeah. And along with that, another part could be doing things like having more family, like inclusion with family or adult services if you are working with a youth and young adult. And so we're going to go on to conclusion and recommendations. So, number one would be prioritize equitable compensation. So advocating for Medicaid reimbursement for YPSW services. Organizations should provide equitable compensation. So things like Medicaid and Medicare reimbursement for YPSWs that is separate from adult and family services. Um, as well as that, recommendations also reported having, like I said, those policies in place for certification and tenure.
So second key recommendation here, and this relates to our finding that those in youth certified peer specialist positions were less satisfied with their workplace conditions than general certified or non-certified counterparts. It's really critical that we ensure that those with this youth certification are appropriately supported. And we think this can be accomplished in several ways. One is to, as Haley alluded to earlier, supporting access to youth certification programs. Not all states offer them, and even in states that do, it can sometimes be hard for young people to obtain these certifications due to the financial burden or other barriers. So we need to be ensuring that we create opportunities for more youth to be youth certified, receive this specialized certification. Second key point here, being careful with titles. So it is possible that more youth-specific certification and calling someone a youth certified peer specialist could unintentionally emphasize a worker's age in ways that could lead to marginalization. So we want to be careful with what we call people in these positions. One idea might be to use a title like Certified Peer Specialist of Youth Services, which shifts the emphasis from the worker to the population that they support. Again, as Haley mentioned, might want to consider tying wages to certification status. This might be helpful, again, because those who have received this youth certification might anticipate greater support or recognition due to taking the time and making the effort to become youth certified. And then finally, it's important that supervision be provided by those who truly understand the unique experiences of YPSWs in this role. There are a number of great recommendations and resources out there related to how to effectively supervise those in YPSW roles. Youth Move has come out with some recommendations, as well as Mental Health America. A lot of great tips there. Um, Using trauma-informed principles in supervision, doing co-supervision or allowing for co-reflection in supervision, where the supervisor is also reflecting on their own experiences, and offering opportunities for mentorship or for young adults to connect with others in YPSW roles so that they're really feeling supported.
So a third part of it is addressing structural barriers. So the first bullet point, so clarifying YPSW roles. And not only clarifying the YPSW role, but also the age demographic these individuals will be servicing and their expectations for the work that they're doing. And and actually, like I said before, the big thing is a lot of people are not being asked to do things that they were initially trained in doing. So making sure that is kind of in alignment. The second would be having appropriate caseloads, whether that's one that is or yeah, one that is not overbearing or underbearing as well. So having a nice balance. Three would be educate staff on the value of lived experience and youth perspectives. So explaining why it's important to have lived experience and why it's valuable in the role that they're in, as well as thinking about how adultism can be problematic if it's not having youth at the forefront. And peers are central and should be treated as such. So again, going back to that, like clarifying the adult or the peer support role, and finally giving professional development through mentorship, supervision, and opportunities for leadership.
Thanks, Haley. And then finally, there are several areas for future research, future knowledge development. Just to name a few, we need to better understand why these disparities in workplace experiences exist among YPSWs. And based on some of our qualitative findings, things like leadership practices, role clarity, um, workforce support, and peer inclusion may play an important role in shaping YPSW's experiences. And this needs to be explored further in empirical research. We also need to investigate how certification impacts things like perceived legitimacy, role clarity, compensation, and job satisfaction. Research could also examine the adequacy of YPSW training in addressing their unique needs and the long-term outcomes associated with workforce development programs. And finally, future research should examine YPSW's workplace well-being, focusing on how things like organizational culture and supervision practices influence burnout, retention, and other job outcomes. So while we acknowledge that there were limitations associated with this study, relatively modest sample size, relatively limited demographic heterogeneity, and some missing data, we do believe that this study contributes important preliminary data and can inform future research in these and other areas. And again, we appreciate your interest in our project. We hope you found this presentation to be useful, and we're happy to answer any questions at this point.
Thank you, Haley and Elizabeth. Kind of a quiet group here today. I'm wondering if anybody in the audience would like to weigh in on whether they work in peer support or with youth peer support or are youth peer support professionals. Oh, we got a raised hand. I want to first thank you both for a really interesting presentation. I think this is talking about a lot of issues related to the developing peer workforce in general, which is that there just needs to be more, more of everything, more experience, more certification, designation as a recognized occupation would be, I think, really helpful. So if the Bureau of Labor Statistics would collect data, and I know there's over 100,000 certified peers in the country right now and growing, that would facilitate research. It's interesting to me that you had many people who weren't certified, and I think that's because youth-specific certifications are not as common, not as widely available. So that would make a difference. I also, things spring to mind like young people often haven't had a lot of other work experience. Often for older people, they're coming back to the workforce after having done something else. But for young people starting out, as you pointed out in the recommendations, it's a problem not having a career path. There's sort of just one outcome. You're certified or you're not, or you're employed or you're not. But it would be very helpful to be able to say, you can become, this level of something, or so on and so forth. But were you able to look at whether these people had prior work history as well, and how that might have affected some of their attitudes?
Yeah, thanks, Jane. That's an important question. I appreciate your reflections as well. That was one variable that we did not collect that I think would have been very helpful to have collected. Hindsight's always 2020 when you're
That's research.
conducting a study. But yeah, an important future direction, really digging into more of these characteristics of those that are in these roles and how that might shape their workplace experiences is very important. I did want to say something in relation to your comment about this being perhaps the first job that young people may have and how they're kind of disadvantaged by not having a longer work experience. And this also relates to a comment Haley made too about Medicaid reimbursement. One way to sort of deal with this issue is to advocate for Medicaid reimbursement of young adult peer support services separately from adult or family, because those adult models may have requirements for work experience or education that many young people would not be able to meet. Something else that I think is encouraging in the state of Pennsylvania, they're moving from having more of these educational or work experiences to prioritizing lived experience. So, as part of the certification process, peers have to provide a narrative of their recovery journey and how they navigated that. And that goes into evaluating whether someone is fit for this kind of role versus how much education they've had, how many hours of work they've completed. So I'm optimistic about changes like that coming down the pike.
That's really interesting. We've had a couple comments. One is hearing from someone who is a youth young adult peer recovery specialist in Tennessee. I'm glad to hear. So do they have a certification program in Tennessee specific to youth?
The youth. That is a great question. I know there were a few states. I'm pulling up the paper now. There
Oh,
are a
that's
few
okay.
states.
I was wondering if Amber could tell us, since they're there.
Yeah, she might know.
Anyway, and Kenneth said funding will be cut. How can we use AI to support YPSWs or replace them? I hope not replace, but
Great question, Kenneth. I just looked back at our paper. Tennessee does look like they have a youth certification. We identified at least 5 states that do: Tennessee, Kentucky, Georgia, Ohio, and New York.
okay.
There may be others, but
But when
Tennessee
you
is
consider
one.
that, sorry to interrupt, their certification, for adults or just CPS in almost all states now, 5
Yeah,
is yeah. Okay.
it's very small. Yes.
Yeah.
So to the second question about AI, I mean, I think this is an issue we're grappling with across the board, right? I think we have to lean into the unique skills and experiences that youth bring to these roles that AI could never replace, right? Um, it's one thing to talk to a chat bot or something on your computer. It's another to really connect with somebody that has gone through maybe similar circumstances and can share a message of hope based on what worked well for them. So I don't see young adult peer specialist roles going away because of that unique perspective that they can bring. I think it's just bringing that out and creating opportunities for young people to contribute in those ways in a strategic way. I don't know, Haley, if you have any thoughts on that topic.
No, I would agree. And I was just thinking too, like I think part of it is like a lot of people don't know what a young like a peer support is, right? So like part of it is like, and then you break it down even further, like a YPSW, people might not know what that is, or like what are you talking about? So I think that getting like the word out that this is a either a career opportunity or support that can be in place is kind of the first step too.
Yeah, just awareness. Yeah. But AI makes me think about technology too, and especially since the pandemic, obviously, one thing peer support saw was trying to transition from in-person services to being maybe trying to do peer support virtually, which I think some people have embraced, might be easier for younger people. I don't know. But again, we shouldn't focus so much on the age. But it's an interesting question where technology will take us.
Yeah. Yeah, we did see a handful of young people that participated in our survey study working in those kind of telemental health settings, or other online spaces, even some like working in a peer support role through online gaming. These are really innovative, I think, areas where we could integrate YPSW roles and reach young people using technologies that they're already engaged in.
Yeah, that's a really interesting thought. Okay, I think that was all the questions we had. So I really wanted to thank you again for, I think this is such an important topic, and thank you for sharing your work with us. I want to thank everyone for taking time out of their day to participate. I especially want to thank the speakers for their work and for presenting today. As a reminder, a video of this presentation will be posted online at the Center for Psychiatric Rehabilitation in case you'd like to access it later or share it with others. In the meantime, when you exit the webinar, you will see a brief survey, and if you could just take a moment to provide us with some feedback before moving on with your day, we would appreciate it. We are in the process of scheduling other webinars in 2026, so look for those announcements in your email. And thank you all, and thank you again to our speakers.
Thank you.
Thank you.
Bye.